The circulation through the heart is the superior vena cava and the inferior vena cava that go into the right atrium, which goes into the right ventricle, which comes out the pulmonary artery, goes to the lung, comes back in the pulmonary veins, which come into the left atrium, which go to the left ventricle, which then comes out through the aorta. The ascending aorta comes out of the left ventricle, becomes the aortic arch, and then proceeds down as the thoracic or descending aorta. The first branch is the innominate or brachiocephalic artery. The second branch is the left subclavian artery. The first branch is the innominate or brachiocephalic artery, and it divides into the left common carotid artery, which passes all the way up into the neck, and almost immediately divides into the right common carotid artery, which goes up to the neck, and the subclavian artery, which goes out to the arm. When it passes out of the chest into the axilla, it becomes the axillary artery, and when it passes into the arm, it becomes the brachial artery. So on this side, subclavian, axillary, and brachial. The venous return comes back similar to the arterial. There's the brachial vein, becomes the axillary vein, becomes the subclavian vein, and when it joins the external jugular vein, becomes the innominate or brachiocephalic vein, and it's similar on the other side. They join to form the superior vena cava, which enters into the right atrium. If we tracked all the intestines over to the cat's right side, we can follow the aorta down through the hiatus. The first branch of the aorta is the celiac artery. It gives rise to two branches. There's one here going over to the stomach and one here that goes up to the spleen. The second branch is the superior mesenteric artery, which goes over to the small bowel. This large organ here is a retroperitoneal and is the kidney. The next branch is the renal artery here that is paired and goes one to the left kidney and one to the right kidney. The next branch is way down here. It's the inferior mesenteric artery that goes to the colon. The aorta gives rise to the right and the left external iliac artery. It then proceeds a little distance on where it gives rise to the left and to the right internal iliac artery. The iliac artery passes under the inguinal ligament and becomes the common femoral artery. Venous return from the lower extremities and the leg mirrors the arterial supply. There's the femoral vein that becomes the iliac vein. The two of them join to form the inferior vena cava, and they're joined by the renal vein, and that passes on up to the bottom part of the right atrium. The blood supply to the intestines, the return blood supply from intestines, does not come through the systemic venous system. It passes through the portal system. The venous return from the intestines from the spleen from the stomach does not go through the systemic venous circulation, but comes through the portal system. And that is very difficult to see, but you can see here's the gallbladder. This is the common bile duct. And then this is the portal vein that's created by the mesenteric vein, the splenic vein, and the gastric vein. Looking on the top of the liver, after secting the diaphragm way, you can see the hepatic veins coming into the superior vena cava.